Greetings from Delhi Medical Association and eMedi News. Welcome to our show Chat with Dr. KK. We have with us Dr. Yogesh Aggarwala, who is Additional Director, Minimal Access Center of Excellence at Fortis Memorial Research Institute, Gurgaon. Welcome to our show.
Thank you very much, sir.
Specifically in the year 2013, which patients of diabetics should undergo bariatric surgery?
So patients who have relatively short-term diabetes, less than 10 years of duration, and who are overweight. They are excellent candidates for surgery for diabetes.
Overweight means BMI more than 32?
32.5 is our benchmark as of today, but there are studies going on where the benchmarks have been lowered to as low as 30.
As low as 30. And if a person is a normal weight and he is diabetic, is there any role of bariatric surgery?
There is definitely a role, but this has to be only after ethical committee approvals and approvals from ICMR, not without a research protocol.
What acts in a bariatric surgery? Is it the reduction in the size of the stomach or something neurohormonal changes?
So basically the resolution of diabetes, neurohormonal modulation has a major role to play. Diabetes was considered primarily to be a disease from the pancreas because of reduction in insulin and non-activity of insulin. But now with the onset of research in gut hormones, they are supposed to play a major role in resolution of diabetes.
So that if you remove the gut, that also plays a major role in removing the diabetes.
In reducing diabetes.
What's the risk involved in diabetic bariatric surgery?
So this
is it still minimally invasive with laparoscopy or robotic is coming in?
So it is minimal invasive, laparoscopic as well as robotic is the in thing. That is the thing which we are looking forward to, and the risks are absolutely minimal. The complications are to the rate of 1% and mortality is 0.5%.
A patient who is undergoing a bypass surgery, can he have a bypass and a bariatric surgery at the same time?
So bypass is a type of bariatric surgery only. And
no, bypass means cardiac bypass. A diabetic patient undergoing a cardiac bypass, can he have a bariatric surgery at the same time, same sitting?
No, not at the same sitting.
It has to be done separately.
It has to be done separately.
Is there any contraindication for bariatric surgery?
Patients unfit for anesthesia are an absolute contraindication.
And that's all. So as far as you are concerned, there is no contraindication.
No contraindication.
If anesthesia say go ahead, you'll go ahead.
Yes, we will definitely go ahead.
Coming away from your bariatric surgery, what are your hobbies?
So my hobby is surgery.
Surgery. So your profession and your passion is the same.
Same, absolutely.
Okay. If you would not have been a surgeon or a doctor, what you would have become?
So I would have opened a chart shop for sure.
Chart shop?
Yes.
That means you're very fond of chart.
Yes.
You're very fond of chart. So what are your views about this brutal gang rape in the city of Delhi?
Sir, I think this event was, worse than, that is beyond
imagination.
Words, beyond imagination. It is most brutal, and I think animals also don't behave in this way. That is how we human beings behave. It is to be.
Do you feel that those persons were psychopaths or they were normal human beings or they were?
So whatever they may be, even a psychopath will not indulge in such brutalities.
Such brutality. Do you feel that the police has been criticized of not giving a first aid at the first line of contact? Do you feel that police personnel should be trained in first aid and cardiac first aid?
Definitely they should be trained, and I believe your organization itself takes a lot of effort in training the personnel in CPR, and your rule of CPR 10 I think needs to be implemented across everybody. Everybody should be trained into it.
So what Yogesh very clearly says is that it's possible to get rid of diabetes in a patient who is overweight, who is obese, and in fact also in some patients with ethical committee approval, if the weight is normal, you can still think of getting rid of diabetes. Let's thank our guest.
Thank you very much.
Yogesh to be with us. Nice meeting. And that's all for today. We'll come back with one more show. Till that, goodbye. Thank you.